I've seen, whether it was cancer, multiple sclerosis, or mental illness or addiction, begins with childhood issues. Well, how can cancer begin with childhood issues, you ask yourself? A Canadian study showed that when children are abused, when they grow up to be adults, the risk of cancer goes up nearly 50%. Why? Because the abuse or the trauma creates coping mechanisms. Now, one of the ways that we cope when children are traumatized, one of the ways they cope with it is to soothe themselves, and then that's where addictions come in. But another way to cope would be is if you get the message that you're not good enough, that you are not worthy enough, then you might spend the rest of your life trying to prove that you are. And how do you do that? By being very nice to everybody. By never saying how you feel, because they might not like how you feel. By never expressing healthy anger when somebody's crossing your boundaries. By working too hard to prove that you're worthwhile. That's why I was a workaholic doctor, because I got the message as an infant, as a Jewish infant under the Nazis in the Second World War. I got the message that the world didn't want me, I wasn't good enough. Well, then you spend the rest of your life compensating by taking on too much, and you're stressing yourself. And those stresses have an impact on your physiology. They have an impact on your immune system. They have an impact on your cardiovascular system, on your heart, on your nervous system. They can cause disease. So most diseases that most of my colleagues, the physicians, think they're just random, arbitrary diseases, they're not random or arbitrary at all. They're the result of life-strong stresses that result from a child's attempt to compensate. So typically, people with autoimmune diseases like rheumatoid arthritis or multiple sclerosis or colitis or Crohn's disease, or for that matter, cancer, if you look at their lives, what you notice about them is they've had great difficulty expressing their emotions because in childhood they were forbidden from doing so. So they compensated by suppressing their feelings, and they have great difficulty saying no. So that when people ask them to do things, they automatically will say yes, and they'll keep doing things even though they're very stressed by it. And then you end up with the body saying no, because they didn't, in the form of illness. I know this is, I'm not telling you proof, because my time with you tonight is too short, but what I can tell you, that is absolutely scientifically unquestionable, is that you cannot separate the mind from the body. So whatever happens emotionally will actually have an impact on your physiology. Because the brain systems that regulate emotions are part and parcel of the same system that the immune system is a part of, the cardiovascular system is a part of, the nervous system is a part of, and the hormonal apparatus is all part of it as well. So whatever happens emotionally also immediately has an impact physiologically. And that's why you can't separate people's emotional lives from their physiology. You can also not separate people's physiology from their relationships. We know, for example, that children whose parents are stressed are much more likely to have asthma. And so that the more stressed and depressed the parents are, the more medication a child might need for their asthma. And why? Because the child's emotions have an impact on the child's physiology, and a parent's emotional states have an impact on the child's emotions. And if you want to look at it more broadly, what are we talking about? If you're looking at the increasing rate of asthma in North America these days, and allergies of all kinds, or the increasing rate of ADHD and depression and all that amongst kids, what's going on? What's going on is that the parents are getting more stressed, and therefore the kids are getting more stressed, and therefore the kids are getting more sick. And it's not a question of the parents not loving their kids, it's not a question of blaming parents, it's not a question of parents not doing their best. It's the question is that because of economic circumstances and greater isolation, the breakdown of extended families, the breakdown of communities, all the uncertainties of modern industrial life, the parents are more stressed, and the more stressed the parents are, the more stressed the kids are. And when the kids are emotionally stressed, That also affects their physiology. Isolation. At the end of life, a number of studies have shown now that when people are emotionally isolated, they're more likely to get sick, and if they get sick, they're more likely to die. And so, for example, amongst elderly couples, when one of them is hospitalized, the other's risk for dying goes up significantly. Why? Because our physiology cannot be separated from our emotions, and our emotions cannot be separated from our relationships. So human relationships are actually necessary to maintain healthy human life. We're social creatures. It also means that in a society where kids are growing up increasingly without their parents, because their parents are too busy working, they have to, and where children are more and more without that support of the clan and the extended family and the community, you're going to get more people growing up in isolation. And then we try and compensate for that with our cell phones and our internet, which doesn't really do it for us, because for real intimacy, for real contact, you need human connections, not mechanical connections. And so what we're seeing is a whole set of dynamics that leave children more hurt and more isolated. As a result, there are many more problems that they try and compensate for through all kinds of behaviors. And the behaviors that lead to physical illness, like trying to be super nice and trying always to suppress yourself and taking on too much stress, or the behaviors that try to compensate by soothing yourself through addictions, they all come down to what happened earlier in life.